Working in the NHS can be hard. It can be difficult. But we used to be able to take pride in the fact that the Commonwealth Institute ranked the NHS as the leading healthcare system amongst the 11 most developed economies in the world. And that was a source of pride for many of us. Unfortunately, that is no longer the case. Gandhi and I will respond and react to their most recent publication of their league tables in this episode of the EGP Learning Podcast. So let's tech enhance your primary care and learning. Let's go.
And
Hi, Gandhi. How are you? Oh,
Ah.
goodness me.
Mistimed that, but yeah, no, I'm good, thanks. And interested to look at this new development that's happened. Yeah, tell us about it.
Yeah, so like we said in the intro, really, I took sort of great pride actually a few years ago because the NHS can have detractors both in this country and in other countries actually as well. And there was a period of time where people in the US were talking quite a lot about socialized healthcare and about how it was the best thing ever or the worst thing ever. And sort of at about that time, an organization called the Commonwealth Institute, which is a US-based think tank, produced a league table of the highest-ranking healthcare systems in the world, or ranked the healthcare systems of some of the world's richest 11 economies. And the UK was top. And the UK was top for a number of years with UK socialised healthcare, aka the NHS. But I think they took a break for COVID, so I don't think we got a league table last year. We might have done, it might have just slipped us by. But now in the 2021 league table, the NHS has slipped from number 1 to number 4th position, which is sad. But they've released a PDF with all of their sort of league tables and rankings and data. And I guess today, Gandhi, we thought that it would be nice to look at that information and do a reaction episode. So we haven't actually looked at the data before. We're going to look through. We're going to react along with you guys and give you a walkthrough of that information. So you've got something to talk about with your patients and your colleagues, and you're sort of familiar with the findings because people probably will be talking about this in the weeks coming up.
Sure. So do you want to bring it up on the screen for us? And whilst we're waiting for that, just a bit of history to it. So I think if I remember rightly, since 2014, the UK has been top of the league tables. So it's a reasonable length of time that we've been top. And in most categories, I think outcomes has always been one of the weakest areas, and particularly cancer outcomes has been one of the weaker areas that we've struggled with. And that's been recognised as well, particularly in the last time round was recognised, and that's why so many changes were made to the way that we try and explore and diagnose cancer in particular. But it's a bit of a shame that it's dropped a bit further, and not just a tiny drop. Dropping 3 places in one go is a noticeable thing, isn't it, Andy?
It is, but let's have a look. In what categories we're not doing as well as the other areas, and we might have some ideas or thoughts about why that is, and and how that might change in the future. It'd be interesting to see how much of an impact we think COVID has had on this, because just sort of reading some of the press coverage around it, I know that some of the areas that have affected the UK's performance, according to those articles, have been things like access, waiting times, outcomes from cancer, which we know have been affected by COVID. So it'd be interesting to see if some of this change is transitory, and we might return to a higher position, or if it's more kind of structural, and we might have to work a bit harder to regain our top of the league status. And sharing. Here we go. So so we're just going through this document cold. We thought it'd be fun to do a reaction episode. So so this is table 1. So ranking all of the healthcare systems in their performance. So overall ranking, I think, is what we're looking at, and then there's the individual areas. So we see that Norway is number 1 in a lot of areas. Equity of access, not doing so well though. It's only care process, and quite what care process is might become more obvious later in the document. Do you know what it's referring to when it says care process, Gandhi?
I think it may refer to the actual journey of the person going through the system and things. And the only reason why I'm assuming that, I mean, we haven't got to the document to understand this in depth, is with America being number 2, I would assume that's down to kind of the process by which people can access or use the care, because access to care is a separate category itself. don't know. We'll find out when
Hmm.
we go down there.
Yeah, hopefully it'll become apparent as we go through the document. So number
Mhm,
one, Norway. Number two, the Netherlands, performing best on access, and their worst area is administrative efficiency. And
interesting.
then three, Australia,
Mhm,
whose best outcome level is actually equity, which I think is interesting.
mhm,
The one thing that always sticks out in my mind about the Australian system is I'm aware I'm no expert in international healthcare systems. Now I might be wrong, but I get the sense that actually there's a minimum charge for seeing your GP in
mhm,
many cases in Australia. So it's interesting that that doesn't affect their equity of access
mhm,
score. We used to talk about in the UK, but no one talks about it anymore, which is interesting.
mhm.
Once considered something that might be helpful.
And looking
And
at
then we've got the UK.
their healthcare outcomes as well, the number one as well, which is important to.
Oh yeah, yeah. So fantastic. So lots to learn from Australia. Australia, much richer country than you might think as well. One of the richest countries in the world, which
Mhm,
is interesting. As is Norway, number one. Netherlands actually significantly richer on a per capita basis than the United Kingdom, as is Australia. We've got UK at fourth. Our worst score is in health outcomes, and our best score, which is four, is tied for access, administrative
mhm.
efficiency, and equity. Interesting outlier is the US, who spend an enormous amount on their healthcare system
Yep.
and achieve the lowest ranking in nearly all of those categories. So that's
Mm.
interesting.
So that comparison of always moving towards the American healthcare system may not be the best one to use, as I think many people have mentioned time and time again.
Yeah, I don't hear many people aspiring towards the American system, to be
Apart
honest.
from the people that control the organizations themselves.
Yes, yes. And then, so what's this next slide then? What do we think this is showing us, Gandhi? I'm just digesting as we go along.
Yeah, so I guess it's just a graphical interface of the comparative health systems, isn't it? So Norway way down at the top in terms of performance, and then right down at the bottom you've got the US, and somewhere just about in the middle is the UK. I can't read the text, Andy, so I'm afraid you're gonna have to help us with that one. It's a bit too small.
Yeah, I think what it's showing us is I think it's sort of uh, showing us the overall sort of aggregate score,
Mhm,
the aggregate performance of healthcare systems, and then these lines are the top three average. So the average of the top three is here, and this is the 10-country average. So this is the average of everybody apart from the US, and then this is the US down here. And it's just a
mhm.
general measure of aggregate performance. So it's just interesting. I suppose it's another way of showing the relative performance of different economies' health systems.
Okay.
Interesting. Canada has a really good reputation within the US. I'm just thinking about in terms of US culture, people talk
Mhm.
about how good they have it healthcare wise in Canada. So it's just interesting to see that that is sort of lower than
Maybe
some
it's
of
just a
these
comparison to
European
the
countries.
American system itself, and that's why they feel it's so much better because 'cause they're looking over the border and saying, "Well, it's so much better than what we have." So there you go.
Hmm.
So
So
this is an interesting one though. Yeah.
keeping up a fair clip here. So healthcare spending as percentage of GDP, and this is change over time,
Mhm,
which is interesting. And each country has a color. So interesting. So just percentage of GDP, gross domestic product. So that's um, all of the economic output of that economy. So the interesting thing to consider here is that the US GDP, say per person,
mhm,
is I can't remember quite what it is, but it's a lot higher than the UK, for example. So
mhm,
generally speaking, per person in the US, they have a lot more economic activity than the UK. Like more than you might think. Like it's in the order of maybe $15,000 more per
mhm,
year. It is significant, and so this is a percentage of that GDP that is spent. So the UK line is sort of here and sort of middle of the pack for other rich countries, excluding the United States, but that difference is greater than it might imagine because the US is spending 17% of their GDP, but their GDP is so much higher than the UK
mhm,
as well. So this sort of underestimates the difference in per dollar spending per head on health. Similarly, a country like Germany does have a higher GDP than the United Kingdom, for example. So that difference
mhm.
between the UK and Germany will be greater in terms of per dollar spend. They might look at per dollar spend later in the document. Any reflections on this graph for you, Gandhi?
So as you mentioned, that obviously we spend a lot less on health than America does, comparatively. interestingly, I think with looking at it in detail, we're the third lowest in terms of GDP spend on health. And if you compare that to a couple of the past few years, we've always been in the lower 3 category, pretty much. So the UK has always spent, generally speaking, a lot less on healthcare than most of the other countries, even when the UK was in, top of the charts and stuff. So the question is, why has it suddenly shifted? What's led to that change? It'd be
Yeah.
interesting to theorize on that particular part.
And also takeaway from here is I think sometimes statistics can be a little bit deceiving. So, for
Mhm,
example, if you look at say 10.2% versus I don't know, let's say France 11.1%, and let's say they spend 1% more of their GDP on health, you might think that doesn't sound like a lot, but that's spending 10% more on health. So if we assume that the budget for the NHS in its entirety is 130 billion,
mhm,
a 10, a 1% per GDP increase to take us up to France's level would be another 13 billion, which is a lot of
mhm,
money. It says it's a 1% increase here, but that's 1% increase is an increase of 10% on the percentage. So, the differences are bigger than they appear.
mhm.
So, next graph. Ooh, healthcare system performance compared to spending. So this is interesting. So
Mhm,
this is attempting to give you a bang per buck evaluation of the healthcare
mhm.
systems. So this is really good. So what are you taking home from this, Gandhi?
So again, UK's middle of the pack by the looks of it. Generally quite, you know, performance-wise doing really quite well, and above average, which is always nice to be. But in terms of spending and stuff, obviously middle. So it's middle, lack of a better term. It's not the best in either category, and it doesn't spend the most, but it's middling.
Yeah. So I suppose where you want to be on this graph is like here. This would be the best place to be, wouldn't it? Because
Yeah,
that's where you're spending less, but you've got best performance. That's
yeah,
where you want to be. Where you don't want to be is like here where the US is, where you're spending loads and you've got sort of lower health system performance.
absolutely.
So
I'd argue Australia is probably the one I would want to be looking at that graph.
yeah, yeah, they're at the upper left of the graph, which is
Mhm,
a good place to be. So quite tightly packed, actually, aren't they? Apart from US and arguably Canada, sort of
mhm,
being significant outliers. Let's move forward. Healthcare system performance scores, affordability. Um, So obviously, what we're not doing is going into detail about what what they actually mean with
mhm,
these questions. What does affordability mean? I think we just have to take it at face value and mean that it's what you get compared to what you get in terms of healthcare compared to your ability to pay, how affordable it is. That's the
mhm,
face value interpretation of that title that I would take. And it's nice to see that the UK does give the most affordable healthcare.
mhm.
Um, and anything else to say about this one? Any other reaction?
I mean, it's a theme we're seeing recurrently through, aren't we? That the US is not performing where it wants to be by any means, or anything, in the UK. To be fair, is doing quite nicely. Interesting that Netherlands and Norway are not far off us in terms of affordability, in terms of performance, and the other aspects of things, and definitely contributes to that top 3 average where we sit. Um, yeah.
It's interesting. Do you know much about how the healthcare system is structured in Netherlands, Norway, or Germany?
No, I'm not actually. Probably gonna have a look at it more in detail now, seeing the results of particularly Netherlands and Norway. They seem to be doing quite well, and whatever they're doing seems to be quite effective. It'd be interesting to see whether they follow a similar system to us, or whether it's a part-funded model similar to Australia, and France and that kind of thing, or whether it's a completely
Yeah.
state-funded model.
Yeah, I'd love to get an expert in this on the podcast to educate us. I
Maybe
wonder if we can
the
find
King's
someone.
Fund I think that'd probably be a good place to look at, I think, for analysis
Yeah,
of this document. I'm sure there probably will be the King's Fund analysis that comes out from this document at some point anyway, so maybe worth us going over that in due course.
yeah, I'd love to dig a little bit deeper into how other countries do it. Although you always get the difficulty of how do you go from what we've got to what they've got. There are transition problems,
Mhm.
and what works in one country doesn't always translate into another,
True.
into another country as well.
Yeah.
So the next one, I'm just looking at how many more we've got. This is the third from last graph.
Yeah.
So healthcare system performance scores equity. Right. I'm having a harder time understanding what they mean by equity here, and it may be dangerous to speculate. But I don't know. Are you taking anything away from this graph?
So you would assume that if you've got a free to access healthcare system, then equity should not be a problem. And Australia is not free to access. They do have to pay a minimum charge, although some people do have reduced cost or free access. And yet Australia is the most equitable system compared to the UK, which is a free to access completely. That is the mantra, and that is the ethos of the NHS itself. No matter who you are, what you are, you will have free access to points of service of care. I wonder if this is more combining it in terms of the outcomes possibly, and how the equity looks overall. And we know that in particularly more deprived areas, the equity of healthcare isn't the same. So the different level of healthcare and stuff they receive is different. Sometimes good different, sometimes not so good different, but it is different. And
Yeah, I think it's one of those things. See, we tell ourselves we have equity of access in the UK, but I'm not sure that we do have equity of access, and we certainly don't have equity of outcomes. Obviously, we look at our local statistics, and we know that people in, so Rushcliffe is a well-to-do area, just outside of Nottingham City, and there is inner city Nottingham, and the differences between life expectancy.
Only a mile away.
It's only a mile difference, but just different side of the river. But the differences between healthy life expectancy and life expectancy is enormous, I think. And I do spend time with this stat, but I can't quite remember the specific stat. But I think it's something as much as 15 years difference in terms of healthy life expectancy, how long you live without having a significant health problem, which is enormous. So I'm wondering if that forms part of this, although it's speculation, but it's nice to talk around these points, isn't it? It surfaces interesting insights into the UK health system, at least. Interestingly, Norway, who are number one, not doing quite so well in this equity score. It just raises a lot of questions, doesn't it, about what happens in these different healthcare systems and what is meant by these measures to which they're being compared. And
I think that's probably exemplified more in the next one.
Yeah, so second to last, cost-related access problems affect lower income populations, especially in the US. So that's a statement. So percent who reported any cost-related access problem to medical care in the past year, 2020, COVID year. So a problem accessing healthcare because of the cost of it is lowest in the UK. So this is a mirror of that affordability graph that we saw a while ago. And higher income people having fewer problems than lower income people. So I guess the sort of things that might start to drift into this in the UK, I can imagine some patients saying, car parks have been free at hospitals in 2020, so it wouldn't be quite this, but saying, well, actually, I have difficulty, accessing because some of the, not the direct costs of healthcare, but some of the associated costs, the costs of getting to appointments is difficult for me because I need to have a taxi, I don't have a private vehicle, it's not suitable for me to use public transport, and whilst people do sometimes get mobility, payments and assistance, I wonder if those are the sorts of things people might be reporting in the UK. And yeah, so US, really big issue for them. Anything else to take away before we move on to the final graph?
No, I think the final one's quite interesting. So shall we have a look at that one?
Yeah. So avoidable deaths and 10-year reduction in avoidable mortality across countries. So a higher number is less desirable. These are the number of deaths per 100,000 population. And then we've got 2009, and then the most recent. So 2009 is that dot, and the most recent year, 2019, is the lower dot. So fortunately for all countries, it's going down. Avoidable deaths are reducing. And the better performing country is Switzerland, Australia, Sweden, Netherlands, Norway. US probably an outlier in terms of starting at a higher point and seeing the lowest reduction. And then got the UK sort of performing second worst in this. Although I was going to say a 19% improvement is good, and I think it is, although actually the majority of countries are making a 19% or greater improvement. So yeah. So, but the UK, I guess, when I suppose 2009, we weren't necessarily performing best in 2009. It would be interesting to see in those years where we were considered to be performing the best on these metrics, what that outcome measure showed.
But as we mentioned, I mean, UK has always been, unfortunately, the area where we've been performing the worst has been outcomes of healthcare. Still seems to unfortunately be that's the case. But I think, it's heading the right direction. That's the best we can take from that particular information that we've got there. But unfortunately, it seems that is this a symptom of some of the wider challenges within the NHS itself? I guess that's worth talking about now. Why have we dropped? What do you think, Andy?
I'm going to ask a question because
All right.
I look at this and I'm just wondering. So one thing I know about healthcare in the UK is that it's really politicized, and that drives a lot of the spending problems actually, and the emphasis of where we spend money, and also the number of times we try and change how we're delivering things in the NHS, the restructuring burden that's often placed on the NHS. It's quite politicized in the UK. And I know that healthcare is quite politicized in the US, and often people, in my experience, people in the US can be quite polarized in terms of their attitudes towards healthcare, depending on what political party they support. Probably more so than in the UK, where there's generally universal support for something that looks pretty much like the current NHS. People just quarrel about how to do it, and it's a bit of a political football, but very political in the US. And I'm just wondering how political healthcare is in some of these other countries. I'd be interested to see a graph showing us how politicized things are. So just a further question from me as an initial response to it, because I often think it would be nice for healthcare to be less political, and it might enable us to make like some difficult decisions that might help. Like we're all aware that in Australia, unless things have changed, for many people there's a minimum cost to, almost a token cost for accessing a GP appointment or healthcare resources, and that will ensure that demand is genuine and necessary. Might have the adverse effect of deflecting some necessary demand, as people don't want to pay the charge and avoid coming with something that they really need to. But maybe those sorts of things that might be politically unpopular to do in a politicized healthcare environment might actually improve the performance of the health system. And I think it's maybe easier to do those things where it's less political. So I'd be interested to know that. That's my initial response.
Okay. I guess I think of it slightly differently. Are we seeing the outcomes of persistent and poor funding of the NHS? And all it took was the downward trend. And I think it's going to be really interesting to see the review of this data in a year or two's time again, when then we'll see the full impact of COVID and how that's impacted the healthcare systems. Obviously, that's a universal thing that's affected every country across the world. So it's not like somebody can say, well, this country's had this issue, this country's had this issue. We've all had the same issue. We've all dealt with it differently as well. But I personally think that this drop is something that was inevitably going to happen, and we've seen it happen because of the horrific underfunding of the NHS system itself, and the view, like you say, that it's politicized. Everything has to be based on what the papers say is how the NHS needs to change, not necessarily what is needed to change in order to have a good healthcare system.
It's also it's difficult to raising taxes is always difficult, and if you have a system that's directly funded through taxation like ours, it's difficult to raise more money for healthcare. This is another idea that might be a bit off, but I think when healthcare isn't that expensive, like in 1948, when there's only so much you can do, there's only drugs. You don't have super expensive cancer drugs or super expensive operations that can prolong life and that we should spend money on, but those aren't there. Healthcare is fairly cheap, and you can probably spend a much lower proportion of your GDP on healthcare, and you can tolerate that from general taxation. If we're going to pay 6% of our GDP on healthcare, that's not that much. It's not that much tax to raise. If to get further improvements, you need to go from 9 to 12 or something, that's a lot more tax, and I think that becomes politically more difficult for a country to do. So for example, if you say to, not necessarily me, because I don't mind paying my taxes too much, but if you say, well, you'll have to pay another 1 or 2% on your income tax to pay for everyone's healthcare, not just your healthcare, but everyone's healthcare, And people think some people, they don't access it responsibly. Actually that grinds a little bit with me. I think that's a different question to saying your health insurance premium for your healthcare is going up, 3% this year, just in line with inflation, every year. I think that's potentially easier for people to swallow. So I think at higher levels of cost, I think people find it easier to feel that they're paying for their own healthcare and not other people's healthcare. This might be, I'm perhaps making
Is that then
an argument for an insurance-based system, which is not necessarily the direction I want to go. But
no, but then is that pushing people towards having an insurance-based healthcare system that actually, if you want effective healthcare, you're gonna have to pay a top up, which is effectively what we're
maybe,
talking about.
yeah, and I think all cards should be on the table in
Mhm.
improving health outcomes. You just got to sort of make sure that people get good value for money, if you can, and make sure that lower income people are protected and that low income people still get good health outcomes, because that is important for everybody. Yeah, it's a really fertile topic for discussion, and we often have
I'm
these sorts of discussions around the coffee table
yeah.
at work, and we'll probably talk about this around the coffee table at work next week.
I'm sure we're gonna have more discussions on this topic in the near future as well, because it is an ever-evolving area. I think it'll be interesting to see how the government responds to this particular news, because it's not a good news story for them at all, particularly with our current government being in power throughout the period that would have had a noticeable impact on this result. So it'll be interesting to see how this develops in the future, to be honest. And
Well,
will we
and
get back the crown?
we'll see, hopefully.
Mhm.
Be interested to know how other people react to this news, and obviously you can let us know and interact with us in the usual channels.
Mhm.
Hopefully this reaction episode has been, reasonably informative and enjoyable for people, and given people something to chat to their colleagues about.
Absolutely. And as always, if you do want to check out any of the other content we've got on these kind of things, have a look at some of the episodes that are probably coming up right about here somewhere. And as always, we're here to help tech enhance your primary care and learning. And we will catch you in the next episode. See you later.